In this video, I'm going to demonstrate how to repair a tear in tendon and ligament. So we're going to insert the needles in the biceps femoris tendon in the fibular head and insert also in the lateral collateral ligament of the fibular head. I'm following the acupuncture meridian pathway, and we are connecting lead A to the needles on a 2 to 100 dense dispersed cycle, which means 2 hertz and then 3 seconds 100 hertz for 30 minutes. And this is a method for medical acupuncturists or acupuncturists. So we use cotton and we disinfect. We have the needles, guiding tube, and we insert it. This follows the meridian pathway, and it's going to get the whole area. All right. So now we take the leads with the hands, we turn it on-off position to 100 for 30 minutes, 2 hertz to 100 hertz in 3 seconds dense dispersed cycle. And we are going to hook it this area and this area. It doesn't matter if your needle bends, that's okay. And now we're going to go lead A. This you cannot go too high because it's the needle, so the patient should feel it right here. About 1 to 2, and you leave it for 30 minutes. And then if you want to turn it off, you go down and press the on-off button.